My name's Chris van Tulleken. I'm an infectious diseases doctor. I've got 2 kids, 6 and 3, and I'm about to have another one, a third girl. And so my kids eat quite a lot of food that I think is harmful and they should not eat. And I don't ban them from eating it, because food is the stuff that binds us to the people around us. It's the basis of friendships, brings people together. And so our food system is a catastrophe, even as it appears to supply us with all this, plentiful, cheap, available food the whole time. I think we're in a moment where people are experiencing this terrible dissonance, where the food they've been brought up on, the food that's sold to them as safe, it's marketed to their children, there are health claims all over it. They're starting to understand that actually it's full of things that aren't healthy.
The moment that sort of food and capitalism really hit each other, and you started to see food as a question of selling more units for increasingly lower costs, everything tipped. My name's Rosie Boycott. I have been many things in my life. Primarily I'm a mum. I've recently become a grandmother. What really scares me about food is that it's stopped being food.
I think most of what is wrong with us is due to what we eat. And you can see the direct link. When I eat junk food, I feel ill. I don't feel good mentally and physically. My name is Eddie. I'm a dad. I've got 3 children, and I'm a fitness coach.
My name is Tim Benton. I live in Yorkshire. I work in London. I do a lot of cooking. We don't have as much choice as people think we have. And what you should know is that you live in the nanny state, and it's the food companies that control it. It is not government, but it's the wrong sort of nanny. It's the kind of nightmare nanny.
So I guess what worries me the most is the pace at which the environmental crisis is unfolding. I'm Rob. I'm an environmental campaigner and author, and I live in Cornwall. It's an agricultural area, and the local economies are really reliant on food production. And if you look 10, 20 years into the future, we're going to see the complete transformation of the countryside, the complete transformation of the employment, the jobs of some of the people I work with and know and count as friends. So huge changes on the horizon, and it doesn't really feel like we're entirely prepared.
My patients are extremely trapped, and they are deprived from eating properly because they can't afford it. So we live in a kind of weird food apartheid where people who live in poverty simply cannot eat the way that people with money eat.
Well, most of my clients are saying it's easier to buy unhealthy foods. So they struggle in their personality. There's skin conditions, depression, anxiety.
So that whole line that is put out by the government or the food industry, in that we only give people what they want, and what they want is junk food, is not true. When the price is right and the availability is right, that's what they'll buy. They'll buy good stuff because that's what they want to give to their kids.
People want real change. There's a real appetite out there for government to respond to some of these challenges with really bold and visionary policies. And we don't have to be narrowly avoiding the worst effects of the climate crisis. We could be building a green, healthy, fair and equitable society, and that's what people are telling me that they really want.
Regulation generally is good for the economy, it's good for population health, it's good for the environment, it's good for everyone.
All of that could make us happier and healthier all the way through our life.
There's a real opportunity for us to have a conversation around what good food looks like.
I sort of feel that if you could make the food system work, you'd make pretty much everything else work too.